extension to scale patients. So it's based in Cameroon, or like the other ones I've mentioned. I think it's the only one that I mentioned that is on this list that is from a francophone country in Africa, and it's very interesting. Next, Avia Record. So Avia Record is part of the ones that focus on system. They focus on helping health systems to health facilities to collect their data, to store their data, help them make informed decisions from the data that they've collected. So they leverage on blockchain technology, which is secure, and it makes it easy for people to store their data. And they serve over 5 countries, over 120,000 patients, and a lot of hospitals are using their platform to store their health information and also process it. And then they also have some other tools for you to access information as just a normal healthcare users. And then they were able to also raise $2.2 million seed funding to digitalize health records, and focusing mostly in Kenya. So another one is Welo Health. So Welo Health is they focus mostly on B2B. That is, they focus on businesses. So people have businesses, and then they have people that are working for them. So their idea is that when you are able to take care of the health of your workers, they're able to work more efficiently, and then they have more productivity. So businesses call them and contact them for them to link them to healthcare providers. So it's just like Uber. So they have a platform for healthcare providers to subscribe, nurses, doctors. So when they subscribe on their platform, they can link these healthcare providers to the companies that need them or the users that need them. So they are just trying to, it's just like ordering for your food on Uber. So you're ordering for a particular healthcare provider to come and see you, or come and meet your healthcare workers. So currently this is based in South Africa, and they have more than 50 nurses that are working, like they call it gig nurses, because it's like a freelancing work, and working with them to deliver access to healthcare provider. Another thing is that they try to provide a platform for the healthcare providers to improve their skills, improve the healthcare workforce, and then for them to be able to provide quality data services through that. So those are all startups that are focusing on more business oriented, and I think we'll be talking about some of the lessons, and I'm sure by talking about some of them, we have gained some insights about some of the ways to provide digital health services. It's not everybody that has to do telemedicine or people talking to patients. You might work on the data, you might work on some other things. Another interesting one is the one that uses, is more of non-for-profit kind of, but it's very sustainable, Cyber Rwanda. So Cyber Rwanda is built by Y Labs. So, and then they focus on Rwanda youth. So they use human-centered design, whereby they interviewed a lot of young people and want to know how they want to access sexual and reproductive health, because this is like a big problem in Africa, whereby adolescents don't have access to sexual and reproductive health services due to a lot of reasons. So they want to provide a platform for young people, especially secondary school students, to be able to learn more about sexual and reproductive health, how to stay safe, how to and have a good sexual and reproductive health lifestyle. And then they try to understand what the young people want, how they want to have the access to information and the services. So Cyber Rwanda launched, and then they have been able to cover about more than 6,000 people were involved in the pilot study to understand the problem. So like I said, they use human-centered design, more of research, and trying to understand how can they solve this problem. And that's Cyber Rwanda. It would be a crime for me not to talk about my belly, which is something I'm also working on. And then what we do is to provide non-for-profit access to target pregnant women in Nigeria, primarily for now. And what we do is to use digital technology like WhatsApp, SMS, and mobile app for pregnant women to be able to follow their health, their pregnancy, learn more about pregnancy, and also get access to quality information and services. And then we combine this with community-based interventions like outreaches and also research, like the publication that we had, which is trying to advocate for postpartum hemorrhage day and for the global community to have a particular day which is focused on solving the major cause of maternal death in Africa. So at this point, I want to ask again, do you have any, are you following, yes or no, before we go to the lessons that we've learned so far? I have just 5 lessons. Yeah, thank you very much, Daniela and Princess.
I'm following, sir. Well done, sir.
Yeah, thank you. So what are the lessons that we've learned from this technology. From the first one is context matters, understand local needs and adapt. So one major problem that might occur is when we don't understand our local context. The fact that we have a poor low bandwidth internet, poor infrastructure, and some other cultural and language barriers that we have in Africa. And putting this into consideration will help the innovation to start to sustain itself and also solve the problem of inequality and not just targeting the high-end users. You might also want to solve problem for people who are living in remote and poor areas. So when building the solution, you might want to focus on how do you want to solve the problem of local languages, probably using language, your solution translated to other local languages. For instance, in my village, the mobile app has English and Yoruba languages as a local language in Nigeria, and some other else innovations also focus on this. For instance, we see Zuri is using SMS services for people that don't have access to internet. So these are some important things that I want to understand. We don't want to focus on the tech so much that people are unable to even use it or have access to it by just thinking that we are in the US or in California. So next one is partnership and collaborations. So you want to work with want to partner with our existing systems. So you cannot do everything on your own. You might not be the one providing the healthcare providers, doing the lab test, collecting the sample, and some other things. You might want to partner with some other existing platform. For instance, Glovo, for instance, is known as a delivery service of food and some other things. They also do sexual and reproductive health delivery. So there's already like a courier services that is existing. You might just want to leverage on them to be able to deliver the products. And then you also focus on some other things. For instance, the Ghana health system. Ghana is one of the countries leading digitalization of their health records, together with Zimbabwe, Rwanda, Kenya, and South Africa. So they partner with Novartis in order to be able to implement the digital health platform for hypertension management. So these are some things that is very important to partner and collaborate. Another thing is address the infrastructure and connectivity challenges. I already said this before, but some other things that I want to focus on, for instance, power supply issues. You might want to use solar powered infrastructure. So like the Ghana Air system, they were able to build solar panels for each of the primary healthcare centers. And some other people also do this in some other countries also, whereby the health centers can still have access, at least to power the systems that is collecting the data with solar power panel infrastructure, mobile-based solutions to make it easy for people to walk around and use your device. Offline enabled solutions whereby when people are not connected, they should still be able to use the mobile app. For instance, my Belém pregnancy app, after you log in and download, you are on the dashboard, if you don't have access to internet, you can still access the health information on the mobile app. Another thing is ensuring sustainability and scalability. So when you are building your system, your model, either is a for-profit or non-for-profit, you want to have a particular model for you to sustain and build and continue to work on it. It might start with funding from investors, grants, government support, and like some of the startups that we've seen that they got venture capitalist support and investors. And then some also work with grants and some work with government. They serve the government directly. So you might want to develop a system to sustain yourself, and then you scale gradually. You might want to scale in terms of the services that you provide, and then you might also want to scale in terms of locations that you cover. So these are some things that you want to be realistic about and not just start from everywhere. So we want to also prioritize data privacy, security, and regulation because you're working with these digital solutions. They are trusting with their personal information. In the traditional system, they know their health record is in the hospital. So, and the case file is there. So they know no, it's not going anywhere. But for this one, they give you the information is on the cloud, and they need to understand that it's actually secure. You're not selling it to other platforms for some other activities or just use it for research without taking their consent. So you want to be, and then you want to also have security so that people don't breach into the system and then expose everybody's data. Imagine posting the health record of a particular politician or something on the platform because they were able to hack into it. And this is why some of the innovation like the AFIA innovation whereby they use blockchain, which makes it more secure. So you might want to follow some international standards like the General Data Protection Regulation and HIPAA, which focus more on healthcare. And you also want to be sincere with protecting the data of the users, which is something that is very important. And the problem now is that we don't have very strong policies that regulate some of the digital solutions in most African countries, and people are not very conscious of their data currently. But we are moving to an age whereby people will actually sue a lot of digital solutions for data breach and some other things, because you will see that privacy policy of most websites, when you click on it, there's actually nothing there, or it's just like a template that was just copied and pasted. So lastly, I want to end with the words of Zanel Matum, who is the founder of Welo Health. She said, start small, start scrappy, validate your idea by acquiring paying customers, and just build. So this for business enterprise, the startups. So you want to just start and then you continue building from there. The most important thing is for you to convert and see people using your services and solving problems. And you continue to make it better from there. Thank you very much.
Thank you so much, Dr. Babatunde, for sharing invaluable insights and expertise on digital health innovations in Africa. We really appreciate your presence here this evening. So, do we have questions? If you have questions for him, please put in the chat box. Any questions, comments? You can raise your hands if you want to ask, or you can put in the chat box. So we have a few minutes for that. Thank you. Okay. I'm not seeing any questions yet, but personally, I have a question. My question is for early career researchers or people who are just maybe digital health enthusiasts. What kind of opportunities are exactly available, or could you recommend for such? Or maybe some platforms that one. Okay, there's a question already, but I think we have two questions that way.
All right, thank you very much. So the first question about the opportunities, where there are this is number one opportunity. There is Digital Health Africa and this network that is organizing this particular program. So provide, I'm sure you share a lot of opportunities on digital health and people learning about this. So and like they said, just start. For instance, at the Innovation and Design Thinking Academy, TIDA. So we have trainings on innovation, design thinking, just like the picture you can see, and hackathons for young people to build solutions on healthcare primarily, but we also focus on some other areas of the SDGs. But this one is healthcare, whereby we brought young people together to co-create solutions on sexual and reproductive health, climate health, mental health, and then um, on gender-based violence. So there are opportunities. So there are, when you check probably opportunity desk on some other platforms, you get to know about hackathons, uh, designathons, and some other competitions or programs that bring people together to stimulate their ideas. You might not like build on what you like the solution you build from that hackathon, but it gives you experience and it gives you opportunity to leverage on that in order to solve some other problems. I've participated in a lot of hackathons, especially from 2019 to 2022. So these are some of them are virtual. You don't have to travel down or some other things. So these are things that I want to jump on in order to start working on things related to digital health. Also, I want to follow some platforms that share ideas about digital solutions, or you want to read about some of the existing ones so that you get more idea. I also want to do internship probably in already existing health tech platforms. I know med tech Africa, I think they do internship opportunities of connecting people to young people to existing digital health startups so that they can get to understand and work with these existing platforms. And then I also want to do research, want to just try to understand, okay, what are the gaps and knowledge gaps I want to contribute. So these are some opportunities that I want to tap into. Then the other question is about how to elaborate on digital health for prevention. So digital health for prevention, for instance, Apoko doctor, like I use him as an example as health influencer, is using digital health to for prevention. So he's creating content, engaging content, compelling content to his target audience on social media to educate them about some preventions, some preventive services, about why you should not do this, why this is bad, why this is bad. And that's also a digital health solution for prevention. It's creating awareness and health promotion. For instance, my belief, we also focus on prevention of trying to educate pregnant women, trying to connect them with services that are already available, their communities, and some other things. So these are preventions. It's cool. Prevention also include early detection. So early detection, like the one Health Tracker does, by helping you in testing and some other things, is also a prevention because if you detect it early, it prevents it from going into other diseases and it's also a form of prevention. So, and then research is also like contributing to policy and also a way of preventing health problems. Then the other question is, my question is, how does this digital solution factor individual who reside in rural communities when a majority of them might have no access to health network? So this is a big problem, and it's something that is always occurring every single time we talk about digital health solution. People will say, how come, what about people in rural areas? There are some digital solutions that solve problems in people in rural areas, but there are some that they solve problems for people in not rural areas. So not everybody will be able to solve problems for people in rural areas. However, most of the problems in rural areas may not necessarily require digital solutions. So technically, digital solution is not the solution to all problems, for Africa problems. So, and then you might also want to like leverage on existing low technology. For instance, there is Zipper Health or something in Rwanda, whereby they deliver products using drones to rural communities. They also platform whereby people collect data, like Helpmo. They collect data using they have like tabs in these rural communities for the health workers. They train the health workers in these rural communities to input vaccine data. Like when people get vaccinated, they input on this platform and then they get to collect the data. So these are some ways that you might want to introduce digital health in rural communities, especially data collection is very important because if you want to solve their major problems, you need to be able to collect data effectively from rural communities, but not like you want to users to be using mobile apps. What works mostly is for the health, already existing health service provider in the rural community to have access to solar panel digital solution, and then people access digital from there as a group and community based. But it does not mean that you don't have to still use community based, and that's why when I talk about my belly, I said we use both community based intervention and digital solutions because digital solution alone might not be able to solve the problem. I don't know if you can hear me.
Yes, I hear you, sir.
Yeah, thank you.
Okay, thank
So
you
I don't
so
know if
much.
I think you understand the
Yeah.
question, the answer.
Yes, from my own end, you've provided answer to my question. Thank you so much, sir.
Yeah, thank you very much. You're welcome.
Okay, thank you so much, Doctor. Please, do we have any more questions? If you do, please drop in the chat box. We have about maybe 3 minutes for that. Then, Doctor, please, could you drop your LinkedIn handle and any other place we could connect you on? Your LinkedIn handle, probably your page as well in the chat box, so we could
All
connect
right,
with you.
no, I will do that now.
Yeah, thank you. Okay. So ladies and gentlemen, in the absence of no further questions, as we conclude this enlightening webinar, I'd like to take a moment to express my gratitude to each and every one of us, and to our exceptional facilitator, Dr. Babatunde. Thank you for your time. Thank you for sharing your expertise and inspiring us with success stories and lessons learned in digital health innovations in Africa. Your insights and all details you provided were really invaluable. And to each of you who joined us today, thank you for your active participation. Thank you for your questions. Thank you for your engagement, because your presence made this brief webinar truly special. So thank you once again, and I would invite us to stay connected with us for future capacity building opportunities. And lastly, before we go, Doctor, would you be giving out your slides?
Yeah, I can send it.
Okay, thank you so much for that. So I think we'll call it a day. So thank you once again, and have a wonderful evening. Bye-bye.